Hello, good afternoon, everybody. My name is Amelia Gasca, and I am the program manager for the Listos California campaign at the Soul Neighborhood Educational Center. Thank you so much, everybody, for joining us at our Emergency Preparedness Town Hall meeting. We are currently working with 11 CBOs throughout San Bernardino County to be able to reach and educate over 210,000 of our most vulnerable community members. For any of you that would like to hear this in Spanish, you are able to call the number on the screen, which is 602-580-9578 with access code 1753988. Para todos los que gusten escuchar esta presentación en español, pueden marcar al número que aparece en pantalla, que es 062-580-9578 y el código es 1753988. So today we have a few guest speakers that will be talking to us about emergency preparedness. Our first speaker is Supervisor Janice Rutherford. So before her speaking, I'm just going to talk a little bit about her. So since being elected in 2010, 2nd District Supervisor Janice Rutherford has led efforts to focus county resources on core public services, balance the need for more jobs with common sense environmental protection, and restore public trust in county government. She served a 2-year term as chair of the Board of Supervisors and was re-elected 2nd District Supervisor in 2014. Janice serves on the board of the South Coast Air Quality Management District, San Bernardino County Transportation Authority, Inland Empire Economic Partnership, and San Bernardino County Employee Retirement Association. She earned a bachelor's degree in political science at UC Riverside before receiving her master's degree in American politics from Claremont Graduate University. Janice lives in Rancho Cucamonga with her husband, Lim, and their 2 boys, Ethan and Noah. They enjoy camping and playing with Legos. Janice is also an avid reader. Please help me welcome San Bernardino County 2nd District Supervisor Janice Rutherford.
Thank you, Amelia. It's a pleasure to be with you all this evening, even in this strange world where we can't actually be together in person. But I'm very grateful that we have this technology that lets us visit and share ideas even in these rough times. So I want to talk to you tonight about 2 things that the county is offering to help you and your family or your business or your organization prepare for the kind of serious disasters that we face in San Bernardino County. Those might be wildfires, they might be an earthquake, there might be some sort of man-made disaster. There are unfortunately lots of things that can go wrong and that can require us to institute our own personal and family emergency plan. We have 2 resources available to help you create that plan and implement that plan when disaster strikes. The first is an app that is available through either the Apple App Store or Google Play, and it is called Ready SB. So that is short for San Bernardino, but if you search Ready space capital S capital B, it should come up. And what this app helps you do is a couple things. First, it allows you to create a plan. It asks you 5 simple questions. Includes where do you live, how many adults and children are in the household, how many pets do you have, where's your emergency meeting place, who's your emergency contact outside the immediate area, and what are other contacts or other people that you'd like to be notified in the case of emergency in your area. So you fill out all that information. And then the county will use the app to push emergency notifications to you. The County Office of Emergency Services will be able to contact you instantly when there are emergencies in your area, provided, of course, that cell phone coverage is available. You will be able to put your status after an emergency so that both county officials and your emergency contacts can check that and see whether you're okay or whether you need help. You'll be able to use that to send an alert that you do need some assistance. We'll also show you evacuation routes with live traffic patterns to help you plan if you need to be getting out of your neighborhood, as well as shelter locations and offline mapping too. In addition, the app gives you information to help you create your plan in response to natural disasters, terrorist attack, pandemics or flu instances, floods, earthquake, and more. And it includes a complete resource list of all of the local public safety agencies and health agencies, including our partners like the American Red Cross, Animal Care and Control, all of the county departments, and local fire and emergency medical services agencies. So that Ready SB app is a very helpful tool for you. I encourage you to download it today, and then be sure to fill everything out so that our emergency folks know where you are and you are able to get the most out of the app by seeing your local resources. The second thing I encourage you all to do is sign up with the Telephone Emergency Notification System. Our shorthand for this is TENS, T-E-N-S. This is a system that uses both listed and unlisted phone numbers that are in the region's 911 database to send alerts to you in cases of life-threatening emergencies. The county updates this database every 6 months, and we have used it successfully in several instances in wildfire and in flood events since it was created in 2004. So the idea is you can sign up here to receive emergency notification in text forms on your cell phone. If you don't have an internet connection and would like to sign up for this service, you can call 211, which hopefully you know is a way to connect you with a variety of service and supports in your community, or toll free at 888-435-7565. Now, we live in the largest geographic county in the United States. We're over 20,000 square miles here in San Bernardino County. We really try to not send county-wide alerts on this system, but to get them more specified to your neighborhood. So hopefully you won't be getting a lot of notifications that don't apply to you. So I encourage you both today to download this app, to make sure you're registered with the TENS system, and make sure you enter a valid San Bernardino County address on the TENS system. That is the address that you'll receive alerts for instead of getting alerts that apply to the rest of the county. So I hope you'll sign up with both of those today, and if you have any specific questions, please contact your county supervisor, whoever serves your neighborhood or your district. We'd be happy to help you connect with the resources that we have available. Thank you very much, Amelia.
Thank you so much, Supervisor Rutherford, for all that great information you just shared right now. We do have a youth promotor. Her name is Audrey, and she wants to go ahead and ask you a question. Go ahead, Audrey.
Hello, thank you for having me. I'm Audrey Nguyen here as a member of the Public Health Youth Ambassadors who are working with El Sol and Loma Linda University to promote awareness about various public health concerns amongst the youth. On behalf of our program, I'd like to pose this question for the supervisor. Beyond what has already been discussed, are there additional measures that the county is taking to best facilitate emergency preparedness amongst its citizens, with a particular focus regarding awareness about evacuation plans, preparation measures, etc.?
Sure. Thank you, Audrey. Good to see you tonight. We at the county have a lot of emergency services that operate at a neighborhood and district level. So if you're in an unincorporated area of the county, so not in a city, but in one of the county areas, there is probably something in your neighborhood, perhaps a CERT program. That's for community emergency response teams. That's where our fire and sheriff's department have trained citizens to act in the local community to do search and rescue, traffic control, and other emergency responses. And we do a lot of fundraising to make sure that each CERT team can have a trailer full of supplies and resources available that's right there in your neighborhood. That's the most significant one, but there's a variety of training and programs that are really specific to each neighborhood. For example, if you live in my district and you're in the Rim of the World communities, there are lots of evacuation routes. There are ways to notify your neighbors and community leaders if you have a senior or someone with reduced physical mobility that they will need help with evacuation. And they're constantly trying to update those lists and have that information available to the neighbors who will need it. So if you're in an unincorporated neighborhood, you want to connect with your community, and you can do that through your county supervisor. If you're in one of the cities, you want to contact your city to find out what resources and how they're organized at the neighborhood.
Thank you so much, Supervisor.
You're welcome.
Thank you, Audrey, for your question. Supervisor, I have one more question that was given to us. So the question is, during an emergency, what facilities, stores, resources, supplies, and assistance are available in your area?
Well, I feel like I just answered that because my area, it covers a really large geographic area, and I have one of the smaller districts in the county. But really, it is done by each unincorporated neighborhood. So in San Antonio Heights or Mount Baldy, the answer is going to be different than it is for Lake Arrowhead
Okay,
or Little Creek. So
great. Thank you, Supervisor Rutherford, for your time, for being here. Is there any closing statement you would like to say before moving on with the other presenters?
sure. Well, thank you for all the work that you're doing in this. And if anyone watching or listening tonight needs any additional information from the county, you can find me on most of the social media sites, or you can go to the county's webpage, sbcounty.gov, and you'll see the supervisors' faces up there. You can click on whichever one of us represents your area. We'll be happy to help you with the individual questions you have and services you need. Thank you for taking the time to prepare for an emergency beforehand.
Thank you, Supervisor.
You're welcome.
Okay, we're going to go ahead and move on with our second guest speaker, which is Dr. Bastian. He's from Loma Linda Center of Health Promotion, and he's one of our partners at El Sol. Hello, Dr. Bastian.
Hi, I think you guys can call me Supervisor Bastian. If we call Supervisor Rutherford Dr. Rutherford, we can switch roles for a day. That would be fun. A little quick note, I remember Supervisor Rutherford when I was training over at county, and can't say enough good things that she does for her constituents in the county. So it was great to see her. It's great to be here today and to be talking about emergency preparedness. It's so important from a medical perspective to be prepared as well. One of the things, obviously, is to make sure you have enough food and water. Usually they say the minimum is about 3 days, but I think if you have a week's worth, you're going to be pretty good. Don't need to go out and build a bomb shelter. Save that for that show on the History Channel. But you also want to make sure you have 90 days of your medicine. Because if there is an emergency, that's something that's more likely to be disrupted first, especially where medicines these days are being prescribed electronically. If there's going to be some type of attack or we've lost power because of some type of natural disaster, you want to make sure you've got a few months of those supplies ready to go. Make sure you have your family contacts who know also what your medical conditions are. There's also a couple apps you can use. One of them is called Medical Emergency ID, and the other one is called My ID. And you can go to the App Store, and that basically you put in your medical illnesses that you have, especially if there's anything that would require perhaps an emergency response. And one of those apps, the Medical Emergency ID, actually has an SOS button, so that once you have all your medical information is in and it's an emergency, you can press that button and it will send all the relevant information to the 911 or to the medical people. So those are a few things right off the bat that are very important. Obviously, if you're in a medical, you're trying to keep yourself as healthy as possible in an emergency. You don't want to forget just the regular pillars of health that we want to incorporate daily. One of them is emotional health. So you want to figure out, do you have any activities that you would do to keep you emotionally healthy in an emergency? Do you know how to meditate? Do you have some books? If we were to lose contact to the internet or TV. So that you have a backup plan to entertain yourself, because your emotional health is very important in an emergency situation. The more healthy you are emotionally, the better decisions you're going to make for yourself and for your family. You also want to find out ways to keep yourself physically healthy at home in an emergency, whether that be some type of exercise on a home gym, or I use resistance bands. so that I can use those at home to do different exercises as well. Making sure that you're getting a good night's sleep and that you're eating well. All of those things are going to keep you strong, able to endure, and be as healthy as possible for the long term. So those are some of the most important key points from a medical perspective to keep in mind if there's an emergency situation. And I'd be open to take any questions.
Thank you, Dr. Bastian, for that information. We do have Audrey, our youth promotor, with a question for you.
Thanks.
Once again, thank you for having me. On behalf of the public health visitors, I'd like to ask this question. In terms of disaster preparedness, I'm sure that many citizens are aware that evacuation efforts are part of these plans, but not nearly enough understand the role of public health workers in the case of an emergency. How would you define the role of health workers and what your aims are in response to emergency situations?
Okay, welcome, Audrey. It's nice to take that question. I didn't catch the last part. It was something about what the public health response would be.
How would you define the health workers and what your aims are in response to an emergency?
How would you define your health workers? I'm sorry.
How would you define the role of health workers and what your aims are in response to an emergency?
Okay, yeah, health workers obviously very important from a public health perspective. They're the people who are the frontline workers. So, if we're in a pandemic, obviously you need to take the precautions that we've been doing here with masks. If there's going to be some type of terror attack, you want to make sure that you're vaccinated as well. But the public health workers are the ones who are going to try to go door to door, or they're going to be helping out in the neighborhoods and the communities. So I would imagine in that circumstance, we're going to work closely with the community health workers because they're going to help translate not only language but culture as we're trying to get the message out to the communities as to steps that we would take in a given emergency. So they're vital, and they're the front line. Did I answer your question?
Thank you so much, Doctor.
Thank you for the question, Audrey.
For that question. I do have another question for you, Dr. Bastian. So for an individual who has a disability or a special need, what additional steps should they take to protect themselves and households in an emergency?
Yeah, I think, even more emphasis should be given on making sure you do have a quick way to contact the medical establishment, let's say one of those apps, or just having a phone number handy, and making sure that you have a good amount of supplies of anything that you use to help you adapt on a day-to-day life. Otherwise, for the most part, if there's going to be an emergency, we're most likely going to be hunkering down at home. There may be some movement to a community shelter. So if you can, I guess, arrange ahead of time with a neighbor or somebody that would be able to transport you to any type of shelter at that point if getting around is difficult for you. But always, I like to say, whether it be, a special needs handicap or another medical condition, try to think a few months in advance so that you have your needed supplies with you. Most insurances will cover you for 90-day supplies for your medicines, and some of them will only charge you a copay for 30 days. And if they do charge you a copay for 90 days, sometimes it's a bargain. So I would give the same advice, but also just for those who may have trouble ambulating, walking or transporting, to make sure you take care of that as an extra step, making sure you know how to have somebody help you get around.
Thank you, Dr. Bastian. And talking a little bit more on that, let's say for those who are not impacted in a natural disaster, what can we do to help our neighbors, our friends that are going through a natural disaster? What can we do to help them and support them?
Yeah, I think the first thing is get to know your neighbors now while we're not in a disaster. It surprises me how many of us we move into a new neighborhood, and the whole get to know your new neighbor, welcome your new neighbor doesn't happen. So even just if you were to go door to door and introduce it in that sense, you know, you're not trying to get into your neighbor's business, but you're just kind of trying to build a local coalition so that in the event, God forbid that something happens, you have each other's numbers, you know, a little bit about some of the things that might cause a crisis in a situation that would be putting them in danger, and offer your help and say that you'd appreciate them also checking in on you in an emergency.
Great. Thank you
Great
so
question.
much, Mr.
Great
Bastian, for
question.
sharing that. Thank you. Those are all the questions that we have. Do you have anything else you would like to add?
No, I think that's all I can think of right now. But you know, everyone knows where we are here at the Center for Health Promotion. So, you know, if you need any advice in terms of getting prepared for an emergency situation, feel free to make an appointment with us. We're at 909-558-4594. You know, go to whoever's closest to you, whoever your insurance covers, but we're here as well. And we can always get you ready. Just let us know that that's what you want to do, and we can work on all the aspects to get you ready for an emergency.
Great. Thank you so much, Dr. Bastian, for your time.
My pleasure. Thanks for having me.
Okay, we are going to continue with our next speaker. We're going to be hearing from Joanina Gascon. Before she speaks, I just want to introduce her. Joanina has been working at El Sol on the Listos California campaign for the last 10 months under multiple capacities. After a short period of time, she worked as a community health worker. She transitioned to being one of the communications coordinators for the Listos program and has since then been working to assist in the digital marketing needs of the campaign. Welcome, Joanina.
Thank you for that introduction. So I'm just going to be here to speak a little bit more on the Listos campaign. I know, Amelia, you mentioned that we do work with 11 other CBOs, and we have set goals to be able to reach out to Californians here. So El Sol has a commitment of reaching out to 210,000 individuals, which is a 20% commitment of the Listos California campaign. So I have a small little presentation for you just to go over some simple steps. Viewers, I'm sure you've seen these before. So why talk about these steps? How do these steps help us in any manner? We'll get started with our next slide here. Like I said, we have some goals. We want to build resiliency in the vulnerable communities we have here, especially within the Inland Empire. We serve both Riverside and San Bernardino County. So we want to be able to make sure that our communities are taken care of and they have all the information. So how do these steps help? On the next slide here, you can avoid unnecessary stress. You and your family will be more prepared and know what to do in the event of emergency. And you will have all the things you need to make sure you're comfortable. I know a lot of people felt uncomfortable and a little bit panicked when the pandemic initially started and there was empty grocery store shelves. Never in our lives have we seen empty grocery store shelves. So these 5 steps here will assist you in helping being better prepared and more comfortable in the event of an emergency. So our first step, which is on the next slide here, would be get alerts to know what to do. So Supervisor Rutherford mentioned 211. 211 is a great resource for information and also for connection to different resources. So that's one available. Supervisor Rutherford also mentioned CERT. That's also an opportunity to train and learn more about how you can be prepared for emergencies and how you can actually help your community be prepared for emergencies serving as a volunteer. We also have the CalOES websites and the calalerts.org. You can sign up and look at sign up to receive different alerts based on the area you're from. You can also go in there and look at what are the possible threats to your home. So if you were to look up your address, am I at risk for a flood, or am I at risk for fires because of the mountains that may be close to my home? So you can look on at different resources that are available to you. On our next slide here, our step 2 is make a plan to protect your people. Now that you have the information of knowing what kind of disasters can occur in your area, we also have the opportunity to make a plan to make sure your family is ready. You have to consider, if I have young kids, what am I going to teach them to do in the event of an emergency? Or in my case, we're all adults, but we never all seem to be home. So we want to be able to make sure we have that communication of where disaster. Step 3 would be get to safety with the things you need. So that's packing ahead of time, having your go bag ready to go. If you have an illness, you want to make sure you pack your medications. If you have any other resources such as a radio or a first aid kit, those are going to help you, one, staying in communication with the most recent updates. And with the first aid kit, you'd be able to take care of yourself or perhaps take care of others, because you never know what's going to happen. Step 4 would be in the event of when we can't leave home. So we have step 3 telling us to be ready to leave, but say perhaps the disaster leaves us unable to leave from where we're at. We want to have a stay box ready to go, filled with food, water, the essentials for you to survive, because we don't know when we would be leaving home. So that's another option. And finally, step 5, Dr. Bastian did mention to make sure to get to know your neighbors. So we want to be able to make sure that you go and share this information with your friends and your family and your neighbors. This shouldn't be kept a secret. We should all be helping each other to help prepare for a disaster. So there are many ways as to how you can accomplish this, but be sure to spread the word. Even sharing or liking this presentation will help spread the word, and people will be able to better know what to do in the event of a disaster. On our last slide here, I know I breezed through these slides very quickly, but I just wanted to share a little tidbit of information. If you're more than interested in learning more, or if you want a full presentation, we do up to our webinars, and you can get more information on how you can better prepare for a disaster. And of course, we can be found on any of our social media pages, Twitter, Instagram, Facebook, and LinkedIn at El Solnec, or you can find us on our website at elsolnec.org.
Thank you so much, Janina, for sharing that great information on how to be better prepared in those 5 steps. We do have a few questions. I'm going to ask Audrey to ask her question.
I don't think I can hear Audrey.
Yeah, Audrey, I don't know if you're muted. Are you able to refresh your screen? Maybe that will help with the audio. Great.
Hello?
Yes.
Okay, perfect.
Great.
Good evening. Thank you for all this information. I know that this is definitely something that the public needs greater awareness about. Now to my question. Surely this pandemic has changed many things, as I'm sure applies to the role of LISTOS as well as community health workers in general. I'd just like to ask, how has the pandemic changed the methods of outreach or goals for your program in particular?
That's a great question to ask. I can tell you that in the pandemic has really changed our methods, but really hasn't changed our goals or our commitments. We are still highly committed to making sure that this information is shared with each individual. So we've had to make the transition to the digital life. So we do digital presentations, and we also have to had to take in safety measures and gone out to, well, with the necessary safety measures taken, we've gone out into the community, we've gone door to door. We've also taken the time to help out with food banks who are in dire need of volunteers. So we've kind of used this as an opportunity. If I give you what you need, can I have this opportunity to share this information? So this mutual agreement has allowed us to build partnerships and build relationships with people to be able to share this information and make sure it's actually getting spread.
Thank you so much.
Thank you, Audrey. I have another question. So two of our main focuses are health and education. Can you please explain why it is necessary to promote these educational materials in our region and how individuals can also spread the word?
Like the supervisor had mentioned, that San Bernardino County is the biggest county in the entire nation, and with that comes a largely diverse population. So with diversity comes this question of how do you educate each person and make sure that there is equity amongst them, because if you teach someone the same way all the way through, the information may not resonate the same because of the resources that are available. So we want to be sure to make sure that this education is spread in a culturally competent and appropriate way to each individual, and make sure we spread the word.
Great, thank you, Janina. So for all of those who are assembling their backpacks, to be ready in case of an emergency, what are some of the items that you feel are very essential to have there? Because sometimes, we may not be able to put a lot of things in there, or maybe just the most essential things based on your experience that we should really have in our backpack.
So with this question, it kind of makes me laugh because I always mention to people, what works for me may not work for you. So we want to be sure we want to have the items that are going to be most essential to you as an individual. When I help my family pack their bags, my mother's backpack looks a lot more different than mine because she does have pre-existing conditions. So we did take the time to go and get the 30-day extra supply of medications. Versus my backpack, I don't like to be cold. I would love to be as comfortable as possible. So I do have an extra sweater packed in there because I cannot stand the cold. I'm the type of person that if I skip a meal, I'm going to get a migraine. So making sure I have some form of food in there. So it's really just looking at yourself and what is most the priority of yourself. So snacks for sure are I would say an essential item, as well as first aid, because we never know what's going to happen. And we got to be able to take care of ourselves because not everyone can take care of us in the event of an emergency.
Great, thank you so much, Janina. Audrey, did you have any other questions for either Janina or Dr. Bastian?
I believe I have one more question for Dr. Bastian regarding the COVID-19 pandemic. In terms of disaster preparedness, I'm sure that no one truly anticipated this pandemic as being one disaster that we'd have to prepare for. Understandably, the youth are very affected by this quarantine regarding issues like mental health, in addition to the physical consequences of being exposed to COVID-19. Something very relevant to the youth are concerns surrounding the safe opening of schools. When do you estimate the time frame would be expecting schools in our area to reopen? And additionally, under what conditions?
Yeah, great question. And some of that is related to the alert system that we have in place. As that starts to go down, as we start to move from widespread to more pockets, then each county can judge based on the guidelines from the governor. Originally, they were looking at if there was 5% in and others that were entering into a second wave. Looks like did you guys get that? It looks like the screen froze there for a few seconds.
No, we can hear you
We
now.
did miss a portion.
Did you hear all that? Okay.
After 5%,
So,
it cut off.
Okay, so the 5% of a particular school with infection, they're going to close the school down according to the governor's recommendations. And I think that's wise. And then if there's 25% of the schools with a 5% infection rate, then they will close down the district. Obviously, as we're entering into, it looks like a second wave, and historically, and the other 7 pandemics that we've been through in the past, it's always come with a second wave, which is a lot more deadly. The difference this time is that we know a lot more about the virus, how it spread, and there's a lot of good therapeutics in regards to the teachers, as they're the ones who are going to be at the most risk. Students, for the vast majority, they're not at risk themselves as much as the older Americans. But if there is a student that happens to have a chronic disease, such as obesity or high blood pressure, or they smoke cigarettes or drink alcohol, high blood pressure, diabetes, all of those things are going to put them at a greater risk. And even if the school is open, they may want to have a discussion about the risks and benefits of continuing to learn in a remote fashion or some type of hybrid model. But for those who, without any underlying health conditions, as long as we follow the governor's plan, which I think Governor Newsom had a well thought out plan, that will help us. So depending on the statistics, and again, it's hard to predict the pandemic, in which way it's going to turn, even as we can see in countries in Europe that did very stringent lockdowns, they're also experiencing a very large, deadly second wave. So we're just going to have to see how that develops. In the meantime, as you're learning remotely, it's important to take breaks. It's important to get on the phone, call your friends, call your family. Try to keep as much of the normalcy that you had when you were in school while you're at home. But yeah, this is I've seen more people with depression, people relapsing in terms of their substance abuse. Obviously, reach out to us. We're open all the time, even during the pandemic. And we can do video visits, and we also have therapy visits for depression and anxiety. We can do that over the phone. We can do that remotely. In addition to even physical conditions, if you twisted your ankle or you have something that you need us to look at, we can often look through the video and do a lot just remotely, and then make sure that whatever you need for recovery, therapeutics, or medication, even referrals, we can do that from the office and have that sent over the internet in a secure fashion. Most of your medical offices these days have what they call a patient portal, and that's an electronic way in which you can look at your notes and request refills. But really reach out and know that if you're feeling down, it's not worth trying to be tough. This pandemic is possibly going to roll on for many more months. And when the vaccines do come out, it's going to be most likely going to be for the medical personnel first. So the average person is not going to have access to the vaccines until at least the first or second quarter of next year. So if you're starting to feel like things are running in the wrong direction, take action. We understand. We're expecting these calls. We've seen this uptick in people with increased anxiety and depression, or even new things. You may be feeling in a way that you've never felt before. Don't discount that it can definitely be from the intense amount of isolation and disruption of the social contact and the regular routine that we're used to. So yeah, give us a call, give your physician a call, and we can help with that. There are medicines that work. When it does come to depression and anxiety, a lot of those medications take 4 to 6 weeks to take effect. So if you start to see it coming on, I would take action early. These are medications that are very well tolerated. They don't cause an addiction. And we can also get you plugged into talk therapy over the phone.
Thank you
I
for
don't know
your
if that
insight.
answered your
Dr. Bastian.
Yeah, you're welcome.
Thank you, Audrey. I just had another quick question for you, Dr. Bastian. So you did mention a little earlier that we can, ask for an additional supply of 30 days for our medication just to be ready in case of an emergency. Is there any way that we would be able to get, let's say, an extra 90-day supply? And if so, is there a particular way that we can ask our provider for that?
Yeah, most insurances will cover 90 days. And yeah, you just let your provider know that you would like a 90-day supply. And most insurances will honor that. They'll either give you a 3-month copay, which could be a month times 3, or some of them actually have discounts if you order 3 months in advance, because it obviously helps them with processing fees and all that stuff. So that's pretty routine for us. And that's one thing that the older generation has on the young ones, is they've been doing that for a while. But maybe some of you younger patients are not aware of that. Especially again, if you're using any type of medication for depression or anxiety. Yeah, go ahead and get that 90-day supply.
Great. Thank you, Dr. Bastian. Thank you again, and thank you, Janina, for joining us and for answering questions. Any closing statements from either of you?
I always just say, if you're looking for updates on COVID or just lifestyle to be healthy, you can follow me at PrevMedPete, or you can also, I've put out a new video on exercising in the workplace, which you can use at home as well. And that's on the Loma Linda University Health YouTube page. It's called Exercising on Empty. And so it's how to find little microbursts of time to do little bursts of exercise, which pay large dividends in terms of, speaking of mental health, improving your mental health, and also just helping you be more energetic at work, feeling more positive, more motivated in general during the pandemic. So if you go to LLUH, the YouTube page there, you'll see the video. It's called Exercising on Empty. So thank you for that little plug.
Thank you, Dr. Bastian. Anything else, Janina, from you?
Just thank you all for watching, and I hope that you go and share this information with your friends, your family, your neighbor, your kids, and making sure that we are prepared, because I know this pandemic caught us all by surprise, and we don't want to be caught by surprise again.
Great. Thank you, Janina. Thank you again, Janina, Dr. Bastian, and Supervisor Rutherford is no longer with us, but we appreciate her time as well. Thank you all of those of you that connected to watch our town hall. Thank you so much, and I hope all of you enjoy the rest of your night. Thank you.
You too. You too.
Thank you.
Ciao, ciao.